Thank you for staying with us. Over 18 million Lagos residents have been vaccinated for preventable diseases under its non-polio supplemental immunization schedule. According to the state government, this initiative is a joint effort with UNICEF to protect children from life-threatening diseases such as tuberculosis, measles, and HPV. Now, these outbreaks have also shown an immunity gap in many communities, and the easiest way to tackle these diseases is to have a statewide immunization activity and also increase routine immunization across Lagos State. Well, joining us in the studio for this conversation is the Immunization Program Coordinator, Lagos State Primary Healthcare Board, Dr. Adetola Akimpelu. Good morning. Thank you for joining us on TVC Breakfast.
Good morning. It's a pleasure to be here.
Right. So last week we had a conversation on this set about an initiative also, brought up by, the minister, the FCT minister, free testing for the population. So talk to us about this program. Is this just a Lagos program, or it is, just a smaller part of the Renewed Hope Health Scheme?
So one of the things that we've experienced as a country, and this is not limited to just Lagos State, is these frequent outbreaks of vaccine-preventable diseases. And these are diseases that over the years, looking back at 2016, 2017, up to 2020, has been on a rapid decline. And this is as a result of the fact that routine immunization had gotten to that level where the acceptance was really high. But unfortunately, of course, we had the pandemic. We led to lots of closure of healthcare facilities. People were not going to access care as they should. It also has brought about a lot of migration, both urban, a lot of people coming in from the urban areas, from the rural areas to the urban areas, people coming in from other countries to Nigeria. And this has also now brought in these vaccine-preventable diseases, and it's been on a rise. So it's a national program with Lagos State, of course, due to our population taking the center stage.
All right, it's good you mentioned the COVID year, and looking at the fact that since then there's been quite a decline in accessing health care. But what do you think might have been the cause? Was it the fact that there was not enough orientation as to the impact or the importance of some of these vaccines needed to prevent these diseases like measles, HPV, and the rest?
So there's been I would say, not really because we did not have the knowledge. The knowledge has always been there. And like I said, there's been an increase initially. But, when you give a gap from constant messaging, because one of the things that humans do respond to is constant messaging. When you continue to pass the information, letting them know the importance of these vaccines. Of course, COVID year took a turn that lots of us did not expect. We're all locked up in the house, we're not accessing health care, we're all about survival. But now we're going back to the fact that, yes, we've gone past the phase of we just want to survive. We want to live a healthy life, we want to live a fruitful life, and we can do this without these diseases, impacting our daily, day-to-day activity. So now we are back saying we need to push this message back out, because this campaign is not really it's not just about vaccinating everybody, but it's also letting people understand the importance of this routine immunization. So we're looking beyond just going beyond mass vaccination, but also educating people, letting people understand the importance of looking at the routine part of the immunization, and also understanding the reason why we need to do a mass vaccination exercise as a state.
All right, so talk to us about the figures that we are up against, and how's the immunization going? I understand it started since last month already. How's it going, and what are the major consequences if we do not address this issue head on?
So we, did start on the 19th of October, right. And I would say that for so far so good, in Lagos State, we've vaccinated over 10 million people for yellow fever.
Okay.
We've vaccinated children, about 2.3 million, with the measles vaccine. And likewise, we've also seen an increase in the demand for the human papillomavirus vaccine. And this tells us that What we did lack was the knowledge. And because our main focus since the beginning of this campaign is to actually let people have the right knowledge, educate them properly on what they need to know about vaccines and how it works. So it's not a, you must take it. No. You must understand the reason why you need these vaccines. We'll give you the right knowledge. Then with this informed knowledge, you can now say, oh yes, I think this is a good thing. I need it. My children need it. And you would come for it. And we've seen a huge, in fact, way beyond what we did expect, because, of course, we're coming in from a period where we had lots of distrust, lots of myths, lots of misconception. But for every time we sit down with people, for every time we sit down with these stakeholders, both the community stakeholders, the religious stakeholders, and every other stakeholder in the states, they've come to understand the reason why this is a good initiative. They've gone back home to also educate their people, and we've seen quite a huge turnout of people accepting these vaccines.
So is vaccination the only way to prevent or to curb the spread of preventable diseases? Is that the only way?
So, you know, we do speak of various levels of prevention. Right. There's primary, there's secondary. Of course, now there's the part of treatments. The first gateway is vaccination, because what vaccination is doing is telling your body primarily to understand that this virus, this bacteria, this pathogen is not good. Recognize it, be able to fight it. So that's a first line of defense. But we have other ways. Of course, we bring in the like cleanliness, keep your environment clean, wash your hands before you eat, sneeze into your elbow. You know, these are also messages that we need to pass. Sleep under mosquito-treated nets. Ensure that you don't create areas where these pathogens can breed. Ensure that you don't pass fecal matter in water that you drink. So this messaging must go side by side with the message that speaks to vaccination. But we need to understand that vaccination is one pathway, and is a primary pathway, is that first line of defense that you can give your body, while you're also practicing every other thing that leads to hygiene, that leads to sanitation, you know, which also gives you a preventive level against these diseases.
All right. So are there strategic centers beyond the primary health centers in place to ensure that this gets to a larger percentage of the population? That's one. And you also mentioned the fact that it's not really a compulsory thing for anyone. However, we see that to an extent this will affect the health of the larger population in the long run. So talk to us about how we can ensure more awareness, or what more can we do beyond what has been done?
All right, thank you. So for where can we get these vaccines? Of course, in all government facilities, be it primary, be it secondary, be it tertiary. You would find teams at their vaccination post. Well, to take it even further, because we also do know that telling 21 million people to come to these facilities, of course, is going to cause a lot of problems. So we're setting up what we call temporary sites in areas, places where you find people. So if you go to places like shopping malls, you go to places like schools, churches, motor parks, you would find these people set up a temporary post.
Please mention a few of those areas, so for those who...
Okay, like, if you go to like ShopRite now, the one at Ikeja, the shopping mall at Ikeja, you would find about 2 teams by the 2 entrances.
Access.
Yeah, two access points. I know, of course, it's absolutely free. Right. If you go to some key motor parks, Ojota, Oshodi, Jibo, these major places, you would find teams also sited there. I'm sure churches, you know, over the churches, mosque, when they do have their gatherings, we find teams going there too, so that we can avail this opportunity. Of course, schools for our children, both not just primary now, secondary, tertiary, they're everywhere. So the plan is, let's give people the opportunity without taking too much out of their time, without it being a stressful process for them also. And going to your second question, you see, the thing about vaccines and the thing about health generally is this. You cannot force people. You can't force healthcare on people. Likewise, you cannot force the healthy lifestyle on people. But you can convince. You can show people the importance, both physically, financially. You know, you show them the statistics, you show them the figures. This was where we started from. This is how we've been over the years since we've introduced these vaccines. This is where we are now. These are other countries that are doing it. So it's not unique to us alone. Okay. It's something that is done worldwide. And with these statistics, we've been able to convince people. In fact, it would take us to vaccines like the HPV vaccine, because one thing is even to convince the parents to give consent. But we also know that children above 7 also have a say. They have to give assent.
Children above 7?
Yes.
Is that what the law says?
There's something called the age of assent. Yeah. So it's not a law per se. But we do understand that at this age, these children understand things. You can explain things to them. Of course, not as in-depth and as graphic as you would explain to the parents, but to the children, they also should understand what they are getting. So we've had instances where the parent says, give my child. But the child says, I do not want. Of course, you've had the consent of the parent, but you cannot vaccinate that child. Without the child also understanding why he or she has to receive that vaccine. So we are moving past just explaining to the adults, but also to talk to the children, because these children, if they fully understand this, are still going to be adults later in life, and if what is ingrained as a child stays forever.
Okay, so we're talking about graphical expression now. How common are these diseases in, well, let me say Nigeria generally, because I'm trying to get people, we're trying to get people to understand the importance of all of this now. How common is this, and give us figures and statistics on all of that.
All right. So we would start from measles. Okay. In Nigeria as a whole, this year, using clinically, not just clinically, but also lab cases that have been diagnosed at the lab, we've had over 10,000 cases within the first half of this year. Out of these 10,000 cases, we've had almost about 500 deaths. And we know that one death is from something that could be prevented is way more than accepted. So that's how bad it's been for measles. For yellow fever in Nigeria, this year, within January to July, we've had over about, I think, no, so I won't give you the exact figures because I really can't, but I know it's roughly close to 3,000 cases. Okay. And one case of yellow fever is regarded as an outbreak. In Lagos State, we've had 6 cases so far. So far, 6 cases of lab-tested, because most people do not even come to the healthcare facilities, because most of these illnesses do mimic other common illnesses, malaria. So we've taken on every sort of medication. It's when it's progressing. So those key features, these are the ones that you now pick when they come to you. And for cases of cervical cancer, fortunately, this is one area that we've had lots of research into as a country, where we have figures. And I could tell you for free that in Nigeria, on an average, we have roughly about 22 women dying of this illness on a daily basis. From cervical, on a daily basis. So these are cases that have progressed from the HPV infection over the years, has moved on to cervical cancer. Of course, we're not big on health checks in the country at the moment. So when it's caught, it's quite late. Okay. And of course, this progresses and it leads to death. So these are figures that we do not want to be a continuity, because these are things that we could have prevented if the right thing had been done.
Right. So you also, mentioned the fact that some of these illnesses, well, they are life-threatening in that sense. But let's talk about the fact that beyond vaccination, What are the options available? Do environmental factors, do they play a role? Possibly poor sanitation, dieting, and others?
So one of the major concerns is environmental factor. So we'll take like yellow fever, for example, for instance. Urbanization is one of the major drivers of this illness. And Lagos State is the urban center of the country. One of the things that also drives measles is where people live in close quarters, and overcrowding is a problem within the states. For things like HPV, one of the more common, what would I say now, causes, of course, is intercourse, definitely, which is the easiest way to contract it.
Yes.
That's the HPV itself. But what makes it move beyond that stage to it becoming cervical cancer is the fact that Nigerians are not too big on routine checks. And it is recommended ideally for a female, you're supposed to, from the age of 35 minimum, you should be having regular pap smears. But if you do a survey in the street and ask 100 women within that age range, say 30 to 50, if they've done a pap smear, maybe 10 will tell you yes. So these are the figures that lets us know that yes, you could strengthen the healthcare system, you know, increase more access to this high-level testing, try to increase more treatment processes, but notwithstanding, the more, what we should also do is reduce the burden of the illness.
All right, so you talked about overcrowding as one of the ways this can spread. We are seeing a situation in Lagos where the government is going to buildings and giving notices for residents to move because the building is not strong enough, it's not fit for habitation. That's talking about the fact that it's not strong enough to stand and it might collapse anytime soon. And we see a situation whereby people are moving from these places because real estate is now expensive. Rent is expensive to less expensive areas in the hinterlands and staying in crowded areas. Is this a recipe for the spread of this disease? And what do you think should be done about all of this?
So, like we would say, when we're looking at overcrowding, which is a problem, right? One thing is constant. In as much as there are economic opportunities in a state, you would have people move in, you would have people move out. And there's nothing you can do about that. But what we're saying is we will try as much as possible as healthcare practitioners, as public health practitioners, to ensure that whichever situation you find yourself, we give you the best that we can. So we will continue to educate, we'll continue to pass the message that overcrowding may not be the best way to live. We'll continue to pass the message that peradventure you find yourself in this situation, these are the things you can do to ensure that you live healthier. Ensure that where you are staying is well aerated. Ensure that your children, if you have children within those settings, are well vaccinated. Ensure that they are well fed. Ensure that those areas that you're staying has good water system. You dispose your waste properly. You eat good food. So these are just, we would continue to pass. But one thing is constant. In as much as an environment is economically viable, there would be crowd coming in. And there's nothing you can do about that.
All right, so talk to us about symptoms. I mean, some persons are yet to, have much knowledge about symptoms of some of these diseases. And talk to us about the impact of self-medication that we still see today.
So, for diseases like measles, like yellow fever, there are common symptoms to both of them.
Okay.
And these symptoms are what mimics the most common illness in Nigeria, which is malaria. Fever, body pain, headaches, malaria. And of course, the average Nigerian would say your first point of call is the community pharmacy where you could get this over-the-counter medications. Now, being viral, there's a chance that the body, these illnesses will run its course. But there's also those ones that it will not just run its course, but progress. Like the human papillomavirus infection. The symptoms are actually also similar to that of malaria.
Okay.
But more often than not, if you take the average person with a good immune system, your body would start to build its own defense, will start to fight it. Okay. We'll look for a way to minimize the illness, because most of these illnesses are also things that you treat symptomatically to give the body a fighting chance to overcome these diseases. But in the place of a vaccinated person, the body already recognizes it. So if, peradventure, a case of measles that would have run for, say, 2 weeks, because the body understands that this is a virus that, if left in the body, can cause more debilitating illnesses, it swings into action immediately and starts to fight against it. So that's the place of the vaccines in the presence of these illnesses.
So when someone has this illness, how long does it take before the person begins to depreciate?
So different illnesses have different timelines. For measles, for instance, at the first point of contact, it takes about 10 days even before the person becomes symptomatic. For yellow fever, it takes about 3 days before that person becomes symptomatic. Now, for the measles case, you may have been symptomatic, so you may have been spreading even before the symptoms starts. Because 4 days before the symptoms is when the person actually becomes a spreader of this disease. For yellow fever, of course, by the time the person starts to show symptoms, then you can spread the illness. The time frame between when it progresses is now when you start to show these symptoms and you do not treat. You don't manage the symptoms. You don't give the body a fighting chance to also fight this virus. Then it can progress to becoming more serious illnesses.
Also, talk to us about... it says that these outbreaks have also shown an immunity gap in many communities, and is the easiest way to tackle this is immunization in that sense. Talk to us about the competency level of the healthcare workers involved. This is coming at a time where we're having the discussion of the brain drain. And for those who may want to visit these health centers and possibly these strategic points that you mentioned, how do we identify those working with the Lagos State Health Board?
All right. So, of course, when these plans did not just start last week. We actually had been put this plan into process since July. We've been training, we've been retraining, we've been strategizing. Okay. So, and we took time to map out qualified nurses that could administer these injections, because unlike the polio virus that just requires 2 drops, this is an injectable. So we needed hands that could do this. So we've been mapping, we've been training, and one thing you would find about them is that for every person that is a member of this team, you would have your ID card on you, and as a healthcare worker, you're expected to also be in your uniform as a nurse to show that you're actually a practitioner, but you would have an ID card identifying you as a member of the vaccination team for this exercise.
So this is actually free?
It is absolutely free.
Okay, so you can walk into any healthcare facility all around Lagos and get it, or is there specifics?
In as much as it's a government healthcare facility. Not state government, a government healthcare facility. And this includes both military and paramilitary.
Oh, okay.
You would be able to get these vaccines for free.
All right. So talk to us about the role of, treatment. Now, the vaccine is for prevention. I hope I'm right about that. Does the vaccine also cover treatment, or you're just focusing on prevention?
So there are different levels to care, like I would say.
Yes.
We operate at the level of prevention.
Okay.
When it comes to treatment, then that's when the secondary, the primary, the clinic itself comes into play, both at the primary level, the secondary level, and the tertiary level. Okay. For most early cases, you could get treated at the primary healthcare centers. Okay. Of course, because these are the places where these symptoms are readily identified. Your samples will be taken to the lab for this test to show what. But if, peradventure, the case had progressed, there are you're now experiencing debilitating signs, like for yellow fever, when the person starts coming with the yellowness of the eyes, that shows that there's a liver involvement, then that has gone beyond primary care. That person would be moved on to the secondary level of care. And if, peradventure, even at that secondary level of care, it's seen that it may be a bit beyond them, then the person will be moved on to the tertiary level of care. So there are different levels of care. It just depends on at what level the person presents.
Right.
All right. So what will, at this point, I'm sure we might have to believe, but what will be your message to Nigerians generally? Because we have not just Lagosians staying in Lagos, we have other people from other parts of the nation in Lagos. What will be your message to them as regards vaccine preventable diseases?
So I would just coin it in one phrase. The vaccines are worth the shots. It's that difference between you having issues from something that you could have prevented and actually not having it. So it's worth the shot.
Okay.
Right. That's a fine place to end the conversation today. Thank you for joining us in the studio, Dr. Adetola Akinpelu. He is the Immunization Program Coordinator, Lagos State Primary Health Care Board. Thank you for joining us once again.
Thank you for having me.
We're still ahead on TVC Breakfast. EFCC takes stance against high-profile offenders. Join us after.